Welcome to Beauty Unveiled. I'm Dr. Angela Sturm. I'm a double board certified facial plastic surgeon in Houston, Texas. And here we talk about the nuts and bolts of facial plastic surgery and answer any questions that you may have but may not have someone to ask. And today we're going to ask, what is a deep plane facelift? Go back in time, and our first facelifts were a skin-only facelift because that's what we knew how to do. And this was way longer ago than than you're imagining, I promise. And basically it's what people ask me to do now, where they're like, can you just lift that skin in just one little stitch? And that's kind of what it was. And it was just cutting out the skin and sewing it back together. It gives you a bit of a pulled look in the beginning and then relaxes over time. And there's a little sweet spot where it looks good and then it will relax. It's not as good of a result. So it either looks like, yeah, you definitely had a facelift. Oh, it looks nice. And did you have a facelift like way too fast? It doesn't last very long because deeper structures are not holding it up. And we're very concerned about the scars because all the tension is on the incisions. And when you put tension on incisions, it tends to make them pull apart and become wider or not heal as well. And then people started doing a SMAS lift, which means that you lift up the skin, you take these deeper structures and lift them where you want them to be and sew them down. So it's like whenever you're making a bed, and if everything's down at the foot of the bed, you grab the crumpled up sheet, you grab what you can and you pull it up to the top and then you just put the blanket on top. So yes, it's tighter and it's smoother, but you didn't look to see if there's anything under there that might be making a little ripple, and some places may straighten out better than others. And that's kind of what happens sometimes with the SMAS lift, is there are ligaments to those deeper structures that you're kind of pulling against whenever you lift. And so when you lift it, the part that is more mobile, like down here, can lift really well. And the part that is at where that ligament is may not lift as well. So you may see where the bottom part lifts better compared to the top. It doesn't exactly match. And sometimes you'll see a little line on people that goes underneath their mouth and up kind of on the cheek. And that is more indicative of the top part of the face not lifted so great. The bottom part lifted really good. Does not happen on everyone. And some of those facelifts look great. They look amazing. They look really good. And it just depends on your anatomy and the surgeon lining, and that creates your result. Your anatomy and the surgeon creates your result, basically. And so people started doing a deep plane facelift, and people have gone back and forth between the SMAS and the deep plane for quite some time. But now the majority of the people that do a lot of facelifts will do the deep plane facelift. And what that means is when you're making that bed, you go underneath the sheet, you make sure there's no socks, anything under there, you straighten it and you pull it all together as one nice clean sheet all the way up, and then put the blanket on top to make it nice and smooth. And so practically, when surgically, that ligament that's holding part of that tissue down, you release that ligament. So you're able to pull the top part of the face, the bottom part of the face, and even into the neck, all as one big unit, all up and in the direction we want it to go. So it gives you a more youthful, more natural appearance. You're able to get that mid-face lifted better. I'm able to get more of the nasolabial fold, more of that marionette line, a whole lot better and more smooth, and even lasts longer because you're not pulling against yourself with that. And then we're not as concerned about the incisions. Like I said in the beginning, very concerned about the incisions. SMAS pretty concerned, but less so. But the deep plane, obviously it's still incisions. We want it to heal very well, but all of that tension has been taken off of the skin, and so it heals like a nice little fine line that fades into nothingness. So that means that we're more comfortable operating on people that are younger. The scars tend to be a little bit more noticeable in the beginning, but then do fade. We're more comfortable operating in people of all skin types, and so before it was, really only, the lighter skin types, that's something that we want to do. But now there's much more comfort in everyone and being able to, take care of all of our patients in the best way possible. So it's really opened up a lot of doors of us being able to give a better result to more people and feel better about the result, the duration that you're going to get more of 10 plus year result up to 15 years. I think the recovery is a lot better. From my patients that had the SMAS lift, they had some discomfort. They could almost feel, it was very tight. They could feel like a pull, whereas with my deep plane facelift patients, it's surgery. So of course there's some discomfort, but it's not the same. They're much more comfortable It feels tight that first night because you're not used to it. But after that, day 2, day 3, people were telling me this was a lot better than they thought it was going to be. They feel better. They're up and around doing things a lot faster, which helps the recovery. And then whenever they have swelling, a lot more of it is out to the side, and the areas where I've elevated the skin are a lot smaller because I'm going underneath the muscle for the rest of the dissection. So their bruising and their swelling is more limited and into areas that you can cover with your hair, you could cover with a scarf, you can cover and be able to do other things. If you're on a Zoom call, really nobody sees that part of your face anyway, so people are able to get back to work and back to like social and normal activities faster. Had people go to the grocery store on day 3. I don't think that I would, but they felt really comfortable and really good, and they were out and about, and I love that. I love that they felt that good. These are all, advances in the deep plane facelift. And then whenever we talk about an extended deep plane facelift, when this first came out, people would really only talk about it in the face and then do the neck differently. When you connect the face and the neck and you go out under that for that one unit that we were talking about pulling up, that's more of your extended deep plane facelift. In appropriate people, we can also remove some of the fat that's underneath that layer in the sublatissimal fat and the submandibular glands, if that's appropriate for the patient, to get an even better definition in the neck. So a lot of things that we can do to really make their result better. And in some of those people, when you're changing some of those things in the neck, they have a better neck than they've ever had before, and feeling amazing about how they're looking and how they're feeling. The transition for me from like SMAS to the deep plane facelift has been a lot easier recovery for my patients, less issues with healing or downtime taking longer or needing more things to be able to get to the point where they are comfortable being out in public. They're going out a lot sooner, and just better result overall. So a lot of surgeons either do one or the other, so it's not necessarily going to this surgeon saying, oh, I want a deep plane facelift or I want a SMAS. It's more finding the surgeon that's how they do it, because there's some people that might benefit from a SMAS, but a lot of people are going to benefit from the deep plane. So that would be my advice as anyone that's going and looking, and interested in having one of these, is find the surgeon that's doing the technique that you're looking for, and really talk to them about how they do it and understand what's going on, and be comfortable with that surgical plan and with that surgeon. Let me know if you have any other questions about facelifting or facial plastic surgery, and give me a like, share, or follow. If you want some more information, you can find me at www.drangela.sturm.com and come in for a consult. We do virtual and in person.